The whole House can be proud of the UK's vaccination programme, with over 22.5 million people now having received their first dose across the UK. We can also be proud of the support the UK has given to the international COVID response, including the £548 million we've donated to COVAX. I therefore wish to correct the suggestion from the European Council President that the UK has blocked vaccine exports. Let me be clear, we have not blocked the export of a single COVID-19 vaccine or vaccine components. This pandemic has put us all on the same side in the battle for global health. We oppose vaccine nationalism in all its forms. I trust that all sides of the House will join me in rejecting this suggestion and calling on all our partners to work together to tackle this pandemic.
Who does the Prime Minister think deserves a pay rise more? An NHS nurse or Dominic Cummings?
Mr. Speaker, as I told the Honourable Lady for the Liberal Democrats earlier on, we owe a massive debt as a society, and I personally, to the nurses of our NHS. And that's why we've asked the Public Sector Pay Review Body exceptionally to look at their pay. We are on target. This government of this party of the NHS is on target to deliver 50,000 more nurses in our NHS, Mr. Speaker.
Keir Starmer.
Mr. Speaker, he talks about recruitment. There are currently 40,000 nursing vacancies, 40,000 and 7,000 doctors' vacancies. How on earth does he think a pay cut is going to help solve that? And frankly, I'd take the Prime Minister a bit more seriously if he hadn't spent £2.6 million of taxpayers' money on a Downing Street TV studio, or £200,000 on new wallpaper for his flat. Mr. Speaker, they say charity starts at home, but I think the Prime Minister's taking a bit too literally. Let me try something very simple. Does the Prime Minister accept that NHS staff will be hundreds of pounds worse off a year because of last week's budget?
No, Mr. Speaker, because, and of course we will look at what the independent peer review body has to say, exceptionally about the nursing profession, whom we particularly value. But what he should also know, and which he should reflect to the House, is that under this government, we not only began by a record increase in NHS funding of, I think, £33.9 billion, but because of the pandemic, we put another £63 billion into supporting our NHS, Mr. Speaker, on top of the £140 billion of in-year spending. And it's because of this government that in 1 year alone, Mr. Speaker, there are another 49,000 people working in our NHS. And that, I think, is something that is of massive benefit, not just to patients, but to hard-pressed nurses as well.
Keir Starmer.
Mr. Speaker, my mum was a nurse. My sister was a nurse. My wife works in the NHS. I know what it means to work for the NHS. When I clapped for carers, I meant it. He clapped for carers, then he shut the door in their face at the first opportunity. And if the Prime Minister won't listen to me, he should listen to what his own Conservative MPs are saying about this. His own side. This is what they say. Behind you, Prime Minister, it's inept. It's unacceptable. It's pathetic. These are Conservative MPs about the Prime Minister's pay cut for nurses. And that's before his answers today. Another of MPs said this, Mr. Speaker, and this is perhaps the most telling of all the comments. This MP said, sitting behind him, "The public just hear 1% and they think how mean we are." Mr. Speaker, even his own MPs know he's got this wrong. Why is he going ahead with it?
Prime Minister.
Mr. Speaker, what the public know is that we're increasing starting pay for nurses by 12.8% over the last 3 years. They know that this government, in the last year, has put another £5,000 bursary into the pockets of nurses because we support them, and as well as the 3,000 extra for training. And of course, it's very, very important that the Public Sector Pay Review Body should come back with its proposals, and we will, of course, study them. But as I say, it is thanks to the investment made by this government that there are 49,000 more people in the NHS this year than last year, 10,600 more nurses helping to relieve the burden on our hard-pressed nurses. That is what this government is investing in.